Yes, from Dallas, Texas, Congressman Michael Burgess, who spent nearly 3 decades practicing medicine and whose district is just miles from the hospital where the patient is being treated. And in New York, medical correspondent for PBS's Need to Know, Dr. Emily Sine. Michael Burgess, I'll start with you. If you could just, first of all, tell me, from a government perspective and a medical perspective, should we be confident in the CDC's contention that this can be and will be contained?
Well, I do think the CDC has been pretty aggressive about maintaining surveillance over in Western Africa and maintaining surveillance here. I've been in pretty constant communication with them since the middle of the summer on this issue. But you know, Dr. Frieden is right. This is a scary disease. It's a scary disease because of the infectivity and the lethality of the disease, and the fact that we don't have an effective treatment, and as it stands right now, we don't have a preventive vaccine. So people are correct to be concerned. I think Dr. Frieden is also correct. The risk is small, but it's not zero. It's not negligible. And as a consequence of the disease, the overall lethality certainly gets people's attention.
Emily, you're not just a doctor, but you're a medical correspondent, so you know how the media responds and how the public responds and messaging. Tell me what your first thought was when you heard there was a case in Dallas.
Really not surprised at all. I really think that this is probably not the last time we're going to see somebody coming from one of the countries where Ebola is such a problem. And I have to say, I know that the CDC has been very aggressive about educating everybody who would be on the front line here in this country about what to look out for, what to be watching for. So the degree of suspicion, I believe, amongst most healthcare workers in this country is very, very high. Having said that, we see a case here of this patient apparently did seek care and really wasn't isolated or hospitalized for a few days after that. So, you know, we've got to perfect our system. What they're doing to protect themselves on the front line is something that doctors and nurses and EMTs do every single day.
Joe.
Yeah, no, Mika, I mean, it's first of all, we want to thank Congressman for being with us, Congressman Michael Burgess. Thank you, Dr. Emily Sine. Greatly appreciate it.